us. You're being recorded. And we're very, very pleased to have Jeffrey Johnson and Kylie Dick from Unite Us join us to tell us today about this really sort of revolutionary way to surround people and services. And we want to learn about it. It is, first of all, free to free and charitable providers. So let's learn more, and take it away, Jeffrey.
Yeah, thank you, Mary. It is a pleasure to be here with you all. As she said, my name is Jeff Johnson, and I am the Community Engagement Manager for the Nashville or Middle Tennessee region. So I cover 15 counties in Middle Tennessee, but Unite Us is across the state. And, it's awesome. I noticed a couple of things in signing in, that there was already, maybe one or two people that had registered that are already partnering with Unite Us through other avenues. And so it's amazing to see you all. And, before we get started, there's a couple of things that I just wanted to touch on. And also, I want Kylie to introduce herself too. But Unite Us is such an exciting company for me. And as Mary said, revolutionary. And I believe that too. What I like about it is that, me in the world of social work before this, it's like you hear tech and it's not always associated with like a positive feeling. Like you think about a tech company. But the more I hear about Unite Us, it's not even just a tech company. We are true community partners. And the difference between us and a lot of people is that you have a Jeffrey in Middle Tennessee, you have a Kylie in East Tennessee. And not only do we help with tech, but we also get into disaster relief efforts. We help host and sponsor events. We volunteer at organizations when you have big events. So there's just a lot of things that are exciting. And before we get into it, I just wanted to mention that. But I do want to give Kylie an introduction too. So Kylie, take it away.
Yeah, good morning. My name is Kylie Dick, and I'm the Community Engagement Manager for East Tennessee. So I cover about 25 counties from Knoxville all the way over into our East Tennessee area with like the Tri-Cities, Bristol area. So I'm really excited to be here with Jeffrey and support this meeting. We have absolutely loved meeting with Mary and learning more about what you all are doing. So we're excited to be here with all of you today and share with you all what we're doing at Unite Us. And similar to Jeffrey, I have a background in nonprofit. I worked 6 years in nonprofit work in Knoxville area. And so really passionate about what we're doing at Unite Us. And I really wish I would have had it as a provider in my area. So I'm really excited to jump into this. So thank you for letting us come today.
Thank you, Kylie. And with that being said, I'm gonna share my screen. I got a little bit of a presentation for you. I won't stick to it word for word, but it helps me stay on track for what I want to share with you guys. So let me get to that. Okay. I'm not trying to share it. Sorry, guys. I want to present it. There we go. Before we get started, one of the things we talk about and just highlighting that we do want to be a community partner is we are yes, we are natives to where we are serving. So, I live in Nashville. This is my community. But I'm not in social work here necessarily anymore. I do feel like Unite Us and me being able to be here is like part of that. But the truth is that you are the experts, and we know that. And so even though we are a healthcare tech company and we're bringing this as a resource and a tool, we know that you all are the knowledge base, and you all are who is serving these community members every day. And so before I start talking about Unite Us too much, I just wanted to pose a question for you all to kind of start off on asking you guys, and something that I'm going to be asking you if you partner with us along the experience along the way is what are the barriers that you experience when you're trying to deliver care and support for your clients? And so I do want this to be open discussion. I like when meetings, people are talking a lot. I don't want to feel like I'm taking up the whole room. So I just want to hear from you guys. When you think about service delivery, when you think about trying to care for your clients, what are the barriers you see on a day-to-day basis?
Billy says older generation challenged with anything computer oriented. Cindy says transportation. You can feel free to unmute and speak if you're not in another, don't have other people around you. Language access, Nikki Ringenberg. Lack of correct knowledge from Stephanie.
Oh yeah, I'm going to get into that for sure. Yes,
Complexity of the healthcare system.
absolutely.
Release this.
All the time, Andrew, all the time. Great. Well, I'll wait a couple more seconds to see if anything else pops up in the chat. But you all are hitting on what I believe to be the barriers too. And that's exactly what Unite Us was formed, and thinking about what are those barriers. And I'm going to talk about that, but that's where our founders got the idea and kind of started building Unite Us, is because they were having barriers and not delivering care, but actually accepting care. They were having barriers in obtaining care. So I'll keep going. I don't see anything else in the chat, but so to start off, our founders are two veterans. And upon exiting the military, they had problems obtaining healthcare, like I said. But the truth is they realized that healthcare, the definition before, needed to be changed. Typically, people look at healthcare as a hospital, which is true, or like our charitable health clinics, our dental clinics, which is true. That is healthcare. But people often forget that healthcare is also your spiritual health from your church. It is also having enough food on the table to eat, to be having the nutrients you need. It's also having clothes on your back in the winter months, or a pillow to lay your head on. So they kind of said, and my infographic, there it is. People often, never include all of those things in health. If you can't make it to a doctor's appointment, you're not going to be healthy. You got to have transportation to get there. If you're not going to be eating the right things and have nutrients, you might have to be going to the dental clinic more often. If you don't have legal or any help like that, you may end up in trouble with your rent and payment assistance. And so there's just a lot of different things to us that need to be redefined in health, what health means. So that's when our founders said, health is actually healthcare and social care, because if all of these things aren't taken care of, you're going to be having a lot more issues. And to speak further on that, the whole aim of Unite Us too, and how we're funded, since it's free for you guys, is that we're saving the healthcare system money, because people are going to end up at the hospital a lot more often if they don't have a place to stay, if they don't have food on their table. So I just wanted to touch on that and how we view health. So they said, now that we understand maybe what the problem is, how is this going to look for organizations on a day-to-day basis? If we're starting to Unite Us and we're saying that this is going to be a solution to one of these issues, what does it look like? So one of the things we kind of prepared is like a sample workflow. So what does it look like for an organization to be using Unite Us? How might they use it on a day-to-day? And later, Kylie is going to be showing a live demo. So you'll be able to see the software in progress. But the way it kind of looks and the way they've kind of said is, somebody comes to an organization. The organization administrator does the normal screening that they have. And what they realized is, so maybe they came to the dental clinic, but maybe they understood that childcare is a big problem with them. Maybe food insecurity is another issue. And maybe they are having other underlying health issues. So through Unite Us, they're going to get consent. One of the things we take into account is client privacy and security, and we'll talk more about that, but they're going to get consent. And then they can send those 3 referrals in real time. Right there, it takes 5 minutes maybe to send a referral. And you can send a batch of 3 at the same time if you needed 3, if they had 3 different service needs. But not only can they send the referral, but they're also going to be able to see the resolutions of those. So normally when somebody leaves our facility, maybe we have to call the client to see if they're obtaining the care. Maybe we never know if they actually fulfilled that referral request. Maybe we don't know if they ever got the care. So now through Unite Us, you're going to be able to track their health journey. So when they leave your 4 walls, you're going to be able to see if the referral is accepted, if they're getting the care. You're going to be able to see notes on that case. You're going to be tracking their journey through the whole system. And then it also makes it more trauma informed. So if you get somebody sent to you, you get to see where their last 3 months have been experiencing the social service world or healthcare service world. So that's kind of our basic workflow. We know that all organizations are different. All of you are unique. All of you are serving a unique population. And so we shift these to make it work for best, whoever is using Unite Us, but this is kind of our birthplace there. It's more than just referrals though, and it's coordination. And I want to talk about that because to me, this is the social worker in me gets really happy, because the truth is that, we do send referrals a lot. And you all probably have organizations on a list that you send referrals to already. And so we're not trying to recreate that. But the beauty is it makes it way easier to talk to each other. So if you have a client, 3 people can be on a care team and y'all can all communicate about what that client needs, how you're serving that client, where can we move them to next? What are our next best steps for that client? And it just really helps for that interagency collaboration. We see all of the times those silos, like we were talking about in the healthcare definition, the silos of care. And we're trying to get rid of the silos because we do understand that a person needs to be in the center of their community. And if we are all wrapping them up and being around them, they're going to get served a lot better. So I do love that aspect, and you're going to see more about that in the demo as well. One of the things I like is evidence. I also was a researcher before. I was at University of Michigan in social work research. And I think you have to, especially in today's world, in order to get grant funding, in order for people to truly believe your impact, you got to have numbers behind it. And so talking about that coordination piece, I wanted to share this because I think it's a really good picture of what Unite Us does and also how it proves impact. So if you looked at the left of this infographic, you can kind of see all of these are incoming requests. So people needing services. I know there's a couple of different terminology, but that's not necessarily important, but all of these are coming in requests for services. So people need this Kentucky Housing Agency's help. And what they're able to do through Unite Us, one, is keep track of what they do on their own. So this is a housing agency. So through Unite Us, they're proving that 81% of their rental mortgage payment assistance cases were resolved. 60% of their housing mediation cases were resolved. That's what they do. They're a housing agency. So they're showing their impact. But then also through Unite Us, they're proving that they're connecting other people to the care they need. And they get to have and support those outcomes as well. So they see that this is a housing agency that's helped 87% of their clients get food needs resolved. Their clients that needed utility payments, 72% of those cases were resolved and 75% the legal. So this is a housing agency that's now getting to prove that the community member coming through them is also helping them access all of these other services, improve their true impact, and what kind of stable they are in the community. So we love that, being able to drive those outcomes. Like I said, because I know I've been talking for a while, I like to hear from you guys. So I put another question in this today just because I want to keep hearing from you all. And that's kind of the name of our game, is that we really want to be hearing from you throughout our relationship. But what resources do you think would better equip you all to support those you serve? And I know that's kind of broad, but I'm hopeful that you all can maybe think of some things that you think of maybe on a daily or weekly basis that would help.
Guys, feel free to unmute and speak. You
Yeah,
can
I
also
would love to
type
hear
things in
from
the
you guys.
chat, of course, but feel free to speak.
This is Billy from the Free Medical Clinic in Oak Ridge. Thank you for your presentation today.
Of course.
I'm still learning what your services are, but it seems like, if I'm understanding it correctly, right now we have a very passive way of connecting our patients to social resources because it's on the website. We give them a handout and they're kind of on their own, but it sounds like you guys would be a proper bridge to put them and connect them into a hub where they're navigated better and someone kind of takes the lead on it. Is that correct? Am I understanding that right?
Yeah, no, you got it. And listen, I know I'm talking a whole lot, and I'm sharing a lot of our internal terminology and a lot of our lingo that we use at Unite Us. But when Kylie does the demo, it's going to make a whole lot more sense because it puts all these words into practice. But no, you got it spot on.
All right, so that would be huge for us because then we can be reassured that we're not being passive, but we just pass the torch and let you guys run with it with them. And so that would be great for our patients. Thank you.
No, thank you. That's great.
I have a question. Can you guys hear me?
Yeah.
Yeah. Okay. My name is Andrew Hawkins. I run the Insure All Tennessee program for the Tennessee Healthcare Campaign. We're a nonprofit. We assist people with getting on TennCare or health insurance through the ACA. This Insure All Tennessee program is a brand new program. We're actually funded not through grants, but through commissions we gain from insurance companies. And we use those to pay me and other agents for the services. Is this going to be something that I can use to, like, let's say I get, because especially with the Medicaid help, I get a lot of low income families that have a lot of needs. Is this something where I'm just going to send them to you guys, or it's something I can use? Because we like to have that relationship with our clients where I'm actually helping them. Is this something I can use to find the resources?
Yeah, absolutely. So we certainly don't like to label ourselves as a resource directory because we feel like that's kind of the last part of what we do, but we do have a resource directory. So one of the things is we want to give more notoriety to the organizations that are within the network and more publicity and more visual accountants like in our network. So there's twofold to that question. If you want to send somebody to an organization that we don't have on the network, you can send it to us and we'll take care of that referral. But if you have a relationship with an organization and they're on the network, yeah, send them to them because we want you guys to have the relationships with them. And that's exactly what that we're actually posing, is that you all are the community support. And we want to just provide the resource for you all. But this is a community service. This is like, we're learning from you what the community needs, and we're going to hand Unite Us to you all to use as you see fit.
Okay. I mean, it's a great idea. I love it. But like, just so you know, like with me personally, I work with a large Hispanic population. The trust factor is a huge thing. I mean, these families, if I told them to call another nonprofit or something, they typically do not follow through. They only trust me. So
yeah. Well,
a
yeah,
lot
go
of
ahead, Kylie.
Yeah, I just wanted to speak to that because I actually work with Centro Hispano in Knox County, and that's something that they have expressed to us as well. So we actively take feedback from you from what could make our platform more accessible to communities that might, fear things like this. So for example, within our platform, we've just submitted a ticket to where we can go and search for service types that serve only undocumented immigrants, because we want to make sure that they're getting service that they feel safe doing. Another safe hold we have intact for that community is that if they just feel safe with you, Andrew, then you can put a note on their face sheet that says, this client does not want to be referred unless it comes from me directly. Please contact me if this client needs to be referred. That way, our clients that might need a little more support or feel a little bit weary about this process have support from someone that they know and they trust, and that it's their journey and that they're autonomous in what their health is looking like. So I don't know if that kind of answers that, but we're
that
always
does.
getting feedback because we want this to be the best experience for communities that otherwise, have those barriers for care. So thank you for bringing that up. I think it's so important.
I hope, and I think this sounds wonderful because, I mean, just as a tool.
Hi, my name is Stephanie Polk. I'm a social worker here at Church Health in Memphis. One of the resources that I would like to see help with is we have a lot of patients that have issues with transportation. And, transportation in the city of Memphis, we even at the clinic have gone as far as, trying to get Ubers, just to make sure they get to their clinical appointments. And a lot of our older patients don't trust the Ubers because of safety issues. But everything now is online. Everybody's implementing everything online, and a lot of our older population, they don't know how to work computers. So myself and my colleagues, we see a lot of us doing applications online for them. But if we can, sometimes some of these organizations kind of go back to the older ways of doing things for our older population, it will help. But the transportation is the biggest thing for us here in Tennessee.
Yep, we see that in Nashville too. Once you get outside of Davidson County, it's impossible. I do know that, Unite Us is working on a partnership with Lyft. I know you said that there's kind of mistrust with some of those rideshare apps, and I totally understand that. I think Unite Us is a beautiful bridge. Like for you, if you're talking to an organization that does have like an online application and most of the time they have to fill that out, the beauty is that if you communicate with them through Unite Us and then on our platform, you could probably close that loop and say, hey, this person's going to have trouble accessing the application. Is there a way we can mediate that or get them a paper form or something like that. So I bet there's a way to fill that. But yeah, transportation is huge. I usually, when I think about Nashville, I usually think transportation and housing are hand in hand, just like so difficult here.
Same here. Transportation and housing.
Yeah, I would be so excited to connect you with Ashley. I heard that you were in Memphis. Ashley is
Yes.
our Memphis community engagement manager, and she's awesome. I'd be happy to connect you with her too, because maybe, we are trying to capture community initiatives here. And so we could put Ashley on the task of trying to find some transportation agencies too that might be able to support you.
Okay, thank you. That'd be great.
And
Awesome.
also, sorry to interrupt, but for another time when we can talk about this later, those of you who have participated in the equity grant, there's a technological workaround for elders who don't know how to, call or don't have a credit card, or anybody that doesn't have a credit card, that was developed by Sustento. So as part of our equity grant, if you're in an urban area that has Uber, they have an app now where you can set it up for them and take all that off of them, and it's free rides. So again, that's an aspect of a program you have access to as a member, Stephanie. We can talk about it another time, and we can fill you guys in too.
Okay, thank you.
Yes, very important. Sorry to interrupt, Jeffrey.
No, I was just thanking everybody for sharing. I do love to talk, don't get me wrong, but I do not want to be the only person talking the whole time. So I love that people share it, and I appreciate it. With that being said, in the essence of time, I am going to kind of click forward here because I do want to give Kylie some time. And sorry, I'm skipping some slides here. Let me see if I can get back. Okay. So with that being said, we're talking about resources. And some of the things we think about is revenue streams. Some of that is being able to prove and track outcomes in order to apply for different revenue streams, or maybe it's being able to see where your money is being spent and seeing how people access your services and being able to divert funds to other programs. And so we talk about measurable impact a lot, and what it looks like to expand mission in a lot of different ways. So I kind of wanted to walk through this slide and kind of talk about more measurables that Unite Us gives and provides. So the first one being time saving. We know that sometimes when you're trying to learn a new process, it can be time consuming, and sometimes people are literally of that. But what we've seen in one of our really successful states of North Carolina is that, yes, they did have to learn Unite Us. There is like a small training that goes with it, but the case closures went from 16 to 2 days, and that's during COVID. So during a time where people are very transient, during a time where it's already hard to access community services, people are stretched pretty thin. The people are getting services 14 days faster than usual, just because we're sending those referrals, we're having the collaboration, and people are getting the care faster. So that's one really cool impact. Enhancing the care is another one. I think because we have that coordination and because we're being able to have that interagency collaboration, we're seeing that external outcomes being, sorry, I just got the admit notification, but we're seeing all of this tracking. And so like that Kentucky Housing Agency, we saw that they got to help them get those other needs resolved. So we're talking here about Connecticut and connecting those clients to more service needs. And so being able to say, these are our clients, and this is how many got resolved. I do want to hit on this because I think it's important. We also get to see how many are unresolved. And I think that's huge because talking about transportation, talking about housing, a lot of times when we make referrals for those cases get unresolved. And when it comes time to needing services or wanting to support a grant effort or wanting to support more funds towards a different way, you say, look, 40 to 60 or 80% of our cases of transportation have been unresolved for this past year. We got to make a change. This is the true, we're proving that we need this. We're proving now that we need support in this area because look at all these cases that are unresolved. So resolved is great. Showing that it's resolved is great, but also showing that unresolved solutions is also great. And then I mentioned the more resources at the beginning because this is a totally different meeting for you all who want it. There's another hour meeting I can have with you about our Insights program, but we really believe in leveraging data too. So we're social workers at heart. And we believe in the community, but there's also a lot of data needs out there for proving what we need. And so we want to be able to leverage the data that we have and the insights for our services to diversify revenue streams, and to grow that way and to make things more efficient. So we do have a little note there that organizations were more efficient in securing funding and diversifying their revenue too. With that being said, I do want to take a second before I hand it off to Kylie to talk about our clients. Because we're a tech company, sometimes people think that we're going to forget about this is a community facing thing, that this is for our community members. And so one of the things that's so beautiful about what we do is that clients are really still at the first and foremost of what our organization. So like I said before, we cannot share client data without their consent, and they can always withdraw that consent anytime. So it's not like one time they're forever consented, their data is always out there. We can withdraw that consent. And with helping with language barriers, we do always like to be cognizant of that. And so the consent is offered, and I don't know how many languages it is now. I know it keeps growing as we kind of get more informed. But at this time it was 50 plus. There are sensitive and protected data types. And I always ask Kylie to say this because I always end up leaving one or two of them off. But we do have certain service types where certain providers don't get access if they don't need to see it. The one I remember off the top of my head is HIV/AIDS, but Kylie, please fill me in for the rest of them.
Yes. So when it comes to our sensitive service types, we have HIV and AIDS, legal needs, anything that involves domestic abuse will be considered sensitive information, as well as mental health. And then a protected entity we have is physical health as well. So all that's to say is if you have someone come into your office that needs food and is also disclosed that they're in a domestically violent situation, that food provider will not be able to access that client is seeking help for a domestically violent situation, because we want to keep them protected in that situation. So, yeah.
Thank you. I always love your support on that, because I think I always leave off the protected one. I think I leave off physical health, but thank you. And then the last thing is security. People often say, are you guys HIPAA compliant? And we are. HIPAA compliance is a big thing, because a lot of times for the organizations we work with, that's a regulation that they have to uphold. But we also have a high trust certification, which to us in the tech world is kind of more high powered, because it means that we're always constantly going through data penetration tests. They're always making sure that we're secure. And honestly, it might be even a little bit harder to obtain that certification. So we really do take in data security as a very serious thing. This is a web-based platform. And so all of the time we are being monitored to make sure that we are secure. This morning we were having a privacy thing, and they wanted to make sure that we were secure. So they literally shut down the network for like 10 minutes to make sure it was good, because they wanted to make sure. Kylie and I were stressing out because we didn't think we were going to be able to show you the demo, but they got it back up in time for doing the testing. So we really do take that seriously. Client data is secure, and our client privacy is our priority. So with that being said, there's like a little fun video here, but Kylie is going to move forward. I'm going to stop sharing my screen. And like I said, all of the things I'm talking about are going to make so much more sense as she shares. So go ahead, Kylie.
Perfect.
Can I ask one question while y'all are transitioning?
Of course.
Hi, this is Lynn. I am at a clinic in Tullahoma, and we are fairly rural. So I appreciate that Unitas is more than a directory, but the fundamental part is if there's nothing in your directory for your area, it's not going to do you much good. Do you guys have, I've spent a fair amount of time thinking about this, Aunt Bertha, helpnow.org, lots of different things, had some interns looking at things for me. So how do you make sure you have the appropriate community support in somewhere like Tullahoma, Tennessee? Appreciate Nashville. There's a lot of places, a lot of resources, but how can I ask, my other partners here in town to make sure their 211 is updated and their Aunt Bertha is updated and you guys are updated. So talk to me about how you get community partners involved in this.
It's a fantastic question. Do you want to go, Kylie?
Well, I was just gonna touch on it because I have a lot of rural communities in my area, and I just thought of one specifically. I serve Monroe County, and we actually have Access Medical there, which is a small rural health clinic in Monroe County, and they're kind of seeing the same thing. You know, this they believe in what Unitas is doing, but it's the power of the network. So they actually invite me to come and meet with their partners in the community to kind of have what we're doing here today. So showing them what we do and how we can serve. But I think one thing that really differentiates Unitas from other companies that kind of are in the same wheelhouse is that Jeffrey and I stay with you all after you onboard. So the idea of like, are people updating their organizations? Is everything, flowing correctly? Is this a good fit for your organization? That's where Jeffrey and I really step in, and we see ourselves as partners in the community. So we want to constantly meet to make sure, are your programs updated? Do people on the network know maybe something you're offering for your community that month? We're really here to be liaisons and make sure that our network is as healthy as possible, because we're both understanding that the network is only as good as we make it. So we really want to see ourselves as community partners, whether that's going into CAB meetings and making sure that people know that we're here and that we want to connect and that we are free. So just continuing to be real community thinkers and maintain like a high level of activity in every community that we serve, so we can be as beneficial to an urban community as we would be to a rural community, which is something we're really, really passionate about in Tennessee. So I don't know if Jeffrey wants to add anything as well.
Yeah, I just want to touch on it because I'm in Chapel Hill, which is a pretty rural area. And, one of the things I'm having to do is being a little unconventional. So there are not always like a bona fide mental health clinic. But, things we've seen is like different little, like for instance, we have they call it something whole hands. I can't remember the guy's name right now off the top of my head, but it's literally kind of like a small grocery store, but they also use Unitas. We have barber shops in other states. Sometimes it's a chamber of commerce using it to be able to identify it. And I know Kylie's probably got other examples of things. So the beauty of Unitas is that really, if you are an organization serving your community, you can get access to Unitas. And so, especially in our rural areas, a lot of times there are places where you might not think health is happening, but it is. And then also, and she'll show you this in terms of geographic and is it the right service? We also are going to try to figure out where do you normally send people and what's the area that we need to build out in order to account for it kind of being rural and people having to try to travel outside of county lines or things like that. But that's a great question. And it's something that we focus on a lot because we know that Tennessee is mostly rural outside of a few major cities. So I always appreciate that question.
Yeah, Mary, you went to the Rural Health Convention, correct?
There. Yes, I was there. That's where I met you all, I think.
Yes. Yes. And when they told us that, I think it's like 90% of our state is considered rural. I'm forgetting the exact county breakdown. So we try to be very, very mindful of that. And any feedback you can give us on how to better connect rural communities, we want to be at the table and learn. Because I think Jeffrey and I both see this job as like every day we're learning something new, and we really want to meet our communities where they're at. So however we can best do that, we definitely want to. Does anybody have any more questions before I jump into the actual platform?
Nikki had a question, and Nikki's question was when you said healthcare was in the list of, or physical health in the list of protected, and everybody here is, almost everybody here is providing healthcare to people like at a physical health level. She wanted a little clarification. Did I do that right, Nikki? Okay.
Yes, perfect. So it's a little different than sensitive. So our sensitive is just kind of like a need to know basis. So those things that we consider a little more sensitive, like domestic violence or HIV/AIDS. So what that means for sensitive is like the sender and the receiver are going to be the only ones who see that journey. So no one else involved in that service type will get to see that. But with physical health, that's really dependent on the type of PHI you might be sending on our platform. platform. And we actually have a pretty good handout that goes through like physical health and what that journey is going to look like on our platform. So I will try to get that to Jeffrey so we can get it over to Mary so we can send that out to you all, just to kind of give you that. But just making sure we're keeping information like PHI as secure as possible. That might look a little different than sending maybe just like basic food referral or whatnot. So if you're going to attach, like you'll see in our demo that I'm about to do, if you're going to attach someone's like health insurance card to their referral, we want to make sure that that is a protected referral. So just a little more protection onto that rather than just like a food or clothing referral. And if that doesn't answer your question, okay, perfect.
That's perfect. Thank you.
Yeah, you're welcome. Can everyone see the Unite Us screen that I have pulled up? Perfect. So this is what it looks like when you log into our platform. It is very, very similar to logging into maybe like an email. I like to really consider this like set up kind of like a Gmail account if you're familiar. So you log in with your email address and your password, and you have tech support. So we have a little chat bar at your login where you can communicate with our IT team with any concerns you might have. Because if you're anything like me, like you're in the social work world, people are very surprised when you hear you work for a tech company. So we have that built in to kind of support you all, which I find really helpful. But I do think this platform is so user-friendly. Coming from nonprofits that use different ones, I really, really love Unite Us. So this is what it looks like when you log into your organizations network. So right now I'm logged in as the Leadership Foundation. This is all fictitious. These are just organizations and people that I've made up. You'll probably recognize some celebrity names because I couldn't think of anything more clever. So when you log in, you'll get to see incoming and new referrals coming into your organization. So that high level overview. Any referrals that you might have in review or waiting for like maybe a supervisor or someone else to look at. Any open cases that you're currently working on, and anything that you've closed. So just that high level of what's going on at your organization. One thing that I really love about this homepage is getting just a very basic overview of what's happening at your organization in real time. So you're going to get real-time updates through this company timeline that shows you what you're doing. So you can see that emergency housing referral was created, who it was created for, and by who, and it's time-stamped, which I really appreciate. I used to work in conjunction with Safe Baby Court through Youth Villages. So if I could have had time-stamped referrals and case notes, it would have made my life so much easier. So I love that you get this high-level overview of what your organization is doing and also what's going on with your clients. So you'll get to see updates with their health journeys as well. So the first thing I want to do is I just want to show you a client face sheet and what that looks like. And also, if you have questions, feel free to unmute or throw something in the chat so it doesn't just feel overwhelming. But I will take pauses in between steps for those two, but please feel free to interact. I'll just do Eleanor Crane here just to show a basic face sheet of what this looks like. So this is a client that we've served at the Leadership Foundation. We know that she's already consented to use the platform. So if we wanted to refer her right then, we're good to go. We have the basic overview of her information. And then we have just a little more granular into what's going on with Eleanor Crane. So we have the first thing, and probably one of like my top 5 favorite things on the platform is the care team. And this is everyone who's interacting and working with Eleanor right now. So this is so incredible when it comes to that coordination piece that Jeffrey was talking about. Being able to know, if you're about to go into court that next day, or you're having a client come into your office and you want to kind of get, maybe an opinion from someone else that's working maybe more diligently with that client. I used to see my clients 3 times a week, so people would probably call me to see what's really going on with them. You can call or message through our platform here, and it's secure. And it gives you that overview of everyone who's interacting with your client, which I really, really love, and it keeps us up to date with that best care. Another thing that's really cool is our clients can consent to interact through the platform. So if you want to message them or send them an email through the platform, you can do that, whether that's, if you work at one of the dental clinics and you want to remind them of an upcoming appointment. you can do that. Or if they need to bring, a new insurance card, you can do that through the platform, which is really awesome. You can also interact with open cases, which is super cool. So you can leave notes and you can attach those to any open cases that client might have. And what that's going to do is ping whoever on this care team is working with that client, so they get that real-time update of what you're working on. And then similarly to our homepage, you're going to get a client timeline. So instead of that overview of what's going on at the organization, you're going to get an in real-time overview of what's going on for that client. I see things going on in the chat, so if you need to pause me, please.
Yeah, can I just read this out loud so everybody can see it, and you can answer it if you want. But Nikki asked, does the care team only include organizations who are enrolled in Unite Us, or can additional care team contacts be added, even if it's just informational?
Yes. So on this, it kind of has two different answers to this. So when you send a referral and an organization accepts that, which I'll show you, they can assign a worker, and that's automatically going to add them to that client's care team. So when they're within the platform, that's how it works. But also you can manually add people. So if there's maybe an out of network case referral that you've made and you know who that care team member is, you can manually add them so you can still interact with them, or other care team members can still know that they're having an out of network referral and this is who they need to contact within that organization. And so then that last thing is just the client timeline. So I really love this. When I used to go do intakes for youth villages, I really wouldn't know what that client had gone through until I walked through their door. And that's totally fine. But when I think of trauma-informed care, one thing that I heard a lot in my last two jobs client-facing was the tiresome of telling their story to multiple providers over and over and over again. So being able to see their journey before you meet them can alleviate some of that trauma of having to repeat their story to another provider working with them. So I really, really love the client timeline as well. Now what we're going to do is I'm just going to show you how to accept a referral within the platform, and then we're actually going to send one. Someone has their hand raised, so I will pause and let them ask a question while I pull that up.
Yes, this is Stephanie Pope again with Church Health. This program is something similar to what we have here that we're using called Driving the Dream. Would it be possible if a patient uses both platforms, or would they still just need to use one platform?
I think, and Jeffrey can bounce off this as he wants as well. I think it depends on the workflow that you have. Is that through the United Way in Memphis?
Yes, ma'am.
Yes. So we do, our CEM Ashley and our state director Rosa actually work pretty closely with the United Way in Memphis and the Driving a Dream. So, and I think that's something we're continuously working on to see how seamlessly we can work together and in conjunction. But a lot of organizations do that. So a lot of organizations already have maybe a platform that they're required to use because of grants. I'm thinking like HMIS in Knoxville is really popular, and they use it in conjunction with Unite Us. So that's really where Jeffrey and I step in, and we have a meeting with you to see like what workflow would look like and kind of see how you can manage both and how we can make that workflow easier. But it's really dependent on your organization and what you see fit for your community that you're serving.
Okay, thank you.
Yeah, you're welcome. And I can't see who has their hand raised, but I did get a notification that someone else does.
That's Nikki.
So I have a similar but different question. So we don't do healthcare directly, but we do healthcare coordination. So we have kind of an EMR meets case management platform that we use. How does that work with Unite Us, or is it just two separate platforms and it's a workflow issue? Because we have like, anytime we contact a patient, there's a note in there about it. Kind of all the things are in there, just like they would be in an EMR. So I'm curious about that interaction or workflow.
Yeah. What system do you use specifically, if you don't mind me asking, Nikki?
We have Charisma Salis because we're a project access program. And so that's what that platform was built for.
Yes, perfect. So one thing that our our organization has just realized is this is very, very common. So we do have interoperability. And what Jeffrey and I can do is we can either see if we already interoperate with that program that you use. And if not, we can always put a note to our team to let them know that this is something that would be beneficial to kind of learn. And it really depends on your organization. I keep going back to Access Medical because that's like my medical organization within my network. But they use Epic. So we interoperate with them. So it's like a little, it's kind of like an extra tab within their system that they already have. That's Unite Us, that they click on it. So if they want to do a screener or something, it's already built within that. And that's just kind of like an extra conversation with Jeffrey and I to figure out how we can make that work and see what the next steps are to interoperate if we don't already.
Yeah, and I'll also add that, one of the things that's beautiful about Unitas is breaking the silo. So some of the systems that we see out there are for one specific silo. And so this is helping try to break across some of those fields. But when we get when we get a system like an EMR or an INR platform, we try to work with that vendor to seamlessly integrate. So how can we make the platforms integrated to where you're not duplicating work at all? And in what we do further, if those organizations aren't really ready or they haven't really got the scope of what Unite Us does, what we usually do is figure out a single sign-on. So it's like very seamless to go between the two systems. And so we know that you're taking like a leap using Unite Us and sometimes having to get outside of your normal workflow. So we do the single sign-on, which helps, not try to duplicate so much and being able to try to navigate the workflow. And that's part of what Kylie said is that, that's where we step in to work with you guys to see how it's a best fit too.
And before I go into accepting a referral, I saw Andrew's question within the chat, that can someone be referred to if they're not physically close to you? Yes. So that just depends on how you want to be configured in our network. So if you want to be a statewide option for people where they can be referred to you, if you're in the Tri-Cities, but you are virtually serving people and you're in Memphis, we can make it to where you would still populate in those networks, even if you're not physically close to those people. So it just depends on your organization and who you're wanting to serve, because we are statewide. And if you serve people outside of the state, we can configure that as well. So it's just really customizable to your organization and what you need from this platform. Anything else? Okay. If something pops up, I can't see anyone's faces because I'm sharing my screen. So just let me know. But I'm going to show you all how to accept a referral within our platform. So this referral is for Blake Street. It's in yellow because it needs action. So kind of like that slow down on a stoplight. We can see who it's from, what network it's from, what service type it's for. So we already know it's for emergency housing. We can see if they've had any interactions since that referral has been sent with the client. So we're most up to date with what's going on. And anything that might be attached. So if they did an assessment with that client, they can attach it, or if they attached any documents, which they did not. So we're going to go ahead and take action on this. And there's a few different options. For today's demo, we're going to accept, but there's a few I want to talk about. If you immediately got that client service, you can go ahead and close it right there and send a note to that provider. If you need to hold it for review, maybe the person who's in charge of that program is out on vacation, you can do that. You can reject. Maybe this is something that you can't serve at this time, and you can send a note back to that provider to let them know, like, hey, we don't have the means to serve this client right now. But my favorite that I like to show is send. I think this is super unique because sometimes, you might get a referral of something that, your program just reached capacity and you haven't informed Jeffrey and I that you need to turn referrals off. You can send. So what it's going to do is auto-populate the service type that it was sent to you for and show you any organization that can also meet that need. So you can kind of pass it on. You might not be able to serve it right then, but someone within our network that can meet that client's need. So I really like that. We don't have to reject referrals. We can send them on and make sure our client still gets that emergent need met. But for today's sake, we're just going to accept this referral into our organization. So we know he needs emergency housing, so we're going to put him in our housing program, and we're also going to assign him to the program director, Molly Smith, and that way it's going to populate on that care team, so the provider who sent it knows to contact Molly if they have any updates with that client. And so that's how you accept a referral onto our platform. And I'll go back to our homepage, and you can see that it's already populated on that timeline, keeping you up to date. The last thing I'm going to do, and I know we're crunched for time, so I'm going to pick Miss Eleanor Crane again. I'm going to send a referral for her. So we're going to refer Eleanor straight from our client face sheet. So what that's going to do, she's already consented to the platform. But if this was a new client, before you could send this referral, it would pull up a page that would give you about 6 different options for consent, whether that's on-screen attestation, which you can do virtually, which is great over Zoom. We already have our legal team that has a script. So you read that, you get the answers, you can consent for the client. You can do paper, you can email consent forms, you can even do voice. So it's really whatever your organization sees fit for how you want to grab consent on the platform. But for time's sake, we're going to do someone who's already in the platform. Service types, these are all the different things that you can send referrals for on our platform. And we're always open to feedback if you think there's another service type that needs to be listed. As you can see, there's everything from employment, you have emergency housing, you have income support, TANF, cash assistance. Like, we really want to make sure we're getting that high level of care for our clients. So really trying to make this as granulated as possible. For today, I'm going to do emergency food. We're going to say that someone came into the Leadership Foundation and they were taking some classes, and they maybe mentioned to a teacher that they are struggling with maintaining food for their family. So once we've selected the service type, I'm going to do the browse map option because I think it's really fun to look at. What it's going to do is it's going to ping whoever can meet that service type within a 50-mile radius of that client. You can obviously make that bigger or smaller based on your client's needs. And one thing I really like about this, I'm going to see if I can make this a little bigger, is you can click on Smokey's Pantry, and what that's going to do is it's going to pull up info about this organization. I really, really love this as a former provider because you already know before you send a referral that they're accepting. So you're not going to send a referral to someone that I used to send referrals into Abyss, and that organization didn't even exist anymore. And I was like, oh my gosh, I just sent a fax to nobody. So I really love that you can see that before you send it. You can see everything that they might meet. And then at the bottom, you can see, like we were talking about, making sure we're inclusive with the language, knowing that they provide maybe Spanish speaking before you send your client there, if it's free, etc. Since this is emergency food, I'm actually going to batch this referral. So I'm going to send it to a few different providers within our network because we want to get this family food as quick as possible. What that's going to do is it's going to select all of these different food options, and it's going to automatically click this box, which is going to recall outstanding referrals. So if Mom's Mobile Kitchen accepts our client's referral first, it's going to automatically withdraw from the other two, so we're not duplicating any work and we're not overwhelming our client with multiple calls from multiple providers. And then, like Jeffrey said, you can also create an out-of-network case if you see fit. The next step is this referral description. So this is your chance as a provider to share your client's story. We want to be trauma informed. They might not want to share it to multiple providers. So this is your chance to give a description of what's going on to that client so they don't have to, which I really, really love. And then the last thing in the referral process here is going to be this document. So if it's maybe for housing, you can send an eviction notice or proof of income, whatever that might be, within your scope of care. So I really love that. It just removes one more barrier that a client might have of getting that care that they need. We're going to click next. And this is kind of any critical information. So since it's food, we have a food assessment. So if you want to do an assessment with your client, you can do that here just to add any extra notes to these referrals. Once that's done, this is your chance as a provider to look over it, make sure you're sending it to every organization you want, the referral description's correct, any contact information that client might have updated, whatever. If it's a Monday and you're tired, you just need to look over it again, and then you can submit. So that's sending a referral. It probably took a little longer than it should because I'm talking through it instead of just going through it quickly. But it takes about 5 to 7 minutes to send a referral on our platform, which is awesome. And then we'll go back to that homepage here too and see that it'll update. So that's really awesome for us. We can already see that we've sent it out. So we're already checking our work. And that is really a very basic overview of our platform, but I know we're running short on time. So I want to like leave some seconds for questions for anyone.
So many more things I'd love to learn. We might have to have a part 2 with Unitas. This is fascinating. How about cost? It's free to you all. It's paid by the hospitals and other, explain that a little bit more, and what do they get out of it other than the wonderful, good referral work that's happening?
Jeffrey, you nail this question, so I'm gonna pass it to you.
Yeah, like we spoke about earlier in the beginning, the hospital systems realize that there's money being wasted in people's social care and physical healthcare needs on the ground level not being met. And so they purchase licenses. And so if you consider every person at your organization who's going to be enrolled in Unitas or have an account with Unitas as a license, they are paying for those because they're trusting in that if we get the people care they need on the ground, that they're going to be wasting less money in somebody like an emergency ride that didn't need to be taken, a 10-day hospital stay because of dehydration and food, not being obtained is not going to happen as often. So that's kind of where the funding comes from. And so we do say it's free for the majority of our community-based organizations. And so, typically not a problem with costs there. Another benefit you guys get, like we talk a lot about data, is once you send or receive 5 referrals or a combination of the two, a total of 5, you also get access to our Insights platform. And this is a very, very, very granular data analyst tool. We partnered with Carrot Health, we actually acquired Carrot Health to help with our data analytics needs. And so basically, you can look at a lot of things. You can look at all of the work your county's doing in terms of service providing. Sorry, my dog is playing with her toy, it's squeaking. You can see your communication with one singular organization. How much have you worked together? You can literally see how different demographics are being treated in your service areas. And you can look at why. You can look at reasons why your population of people who are identifying as Hispanic or Latinx, how they're not getting treated the same as somebody who is white or Caucasian. So you can literally look at those. We even have an Insights predictive analytics about, who is in the workforce that can work, who's able-bodied, who doesn't have a job, and why. So there is some really neat stuff, and it's another hour-long presentation because it has so many aspects within it. But that Insights is a huge tool. And then you also have Kylie and I. If you need an organization and you can't find it, it's our job to kind of dig deep to find it. If you need a workflow conversation and figuring out how it fits for you, that's where we come in. If you guys want to have an event and want Unitas to sponsor it, that's where we come in. So you do get us, which I think is great. So there are lots of other benefits as a part of this, and also that collaboration. I mean, being able to see and prove the work your community is doing as a whole, this holistic impact to me is huge. The collective impact of y'all's TCCN network. I mean, just being able to see all of your users and seeing what that's like is huge. So real quick, I kind of have this next steps slide up. The PRF is what it takes for you guys because there's no cost. So this registration form takes anywhere from 10 to 20 minutes because it's like describing your organization, what you all do, what programs you would want to be enrolled. You could do this with any of your programs or just one if you wanted to try Unitas out. There's no contract, so it's not like you guys have to sign up for like a 2-year. There's no like oath you have to say or anything. It's just a registration form and then a training. The training is basically what Kylie did, but maybe 20 minutes longer. And so we do that. And then I also included our information. Like I know Billy wanted Kylie to reach out in East Tennessee, but I also wanted to leave both of our emails. And then For our West Tennessee folks, I'll get you connected with Ashley as well. Yeah, thank you all for having us. I really appreciate being able to learn from you all, and really hope I get to work with you all on a deeper level as we go forward.
Thank you for presenting today, both of you. Very interesting. I know I'd love to learn more, and I'm sure other members would too. So if folks do want an additional webinar through TCCN, let me know. And maybe we can talk about how TCCN can be creating kind of more of a statewide initiative. I know other states have done that. I hear about that, and I'm interested in that opportunity.
44 states wide, Unitas is. So
we want Tennessee to check it out. Thank you all. Feel free to email me or Jeff or Kylie. Let us know how we can serve you. Thank you.
thank you. Thank you, Mary.